Hi, this is Dr. Greg Grillo with Express Dentist. Everywhere you look, somebody's talking about AI. And I did a video a while back about different applications of AI in dentistry, but this continues to evolve fairly rapidly. And I think what's interesting is how can AI be applied in a way that directly impacts patient care and the quality of care that they receive very quickly. And one of the best applications that I currently see is the use of AI in the clinic to help diagnose, detect, quantify cavities and gum disease, especially. And so, these are two conditions that the clinical evidence is usually fairly clear, but especially with smaller cavities or smaller amounts of gum disease where there's bone loss, it can be very difficult to really quantify, how advanced that is or how serious it is if it needs treatment. And so AI is giving us just one more piece of evidence, and I think a fairly good one, to help with treatment planning. So, if dentists are to look at x-rays, for example, and you have small cavities between the teeth, they can be challenging to determine if they really need to be treated yet or not. And AI is helping remove that concern, that area that's a little bit gray sometimes. And you could give a set of x-rays to 5 different dentists and you could come up with 5 different treatment plans. It's not always because somebody's dishonest. It means that there is some of this gray area that we have to use our judgment and our experience to try to figure out what's going on. And so I think AI gives us an opportunity to eliminate some of that, which can help build more trust and more credibility and more confidence as well for clinicians that are trying to do the right thing, not let things get out of hand, but not overtreat as well. Because we know in most cases, a little bit of decay or a little bit of gum disease will become a little bit more as time goes on, and it gets more serious and more extensive and more expensive to treat as it advances. So what AI can do currently in some of the programs right now today, if your dentist has that technology, is it can scan your x-rays and it can actually detect those small cavities or the bone loss that's occurring, or even the amount of tartar calculus that's underneath the gums, and it can quantify it. It can determine if this is something that needs to be treated or not. Now, ultimately, it's the clinician's judgment that to decide if the treatment needs to take place. And however, that extra information from the AI and the way it's able to scan, say, the demineralization of the tooth and determine how much is demineralized or how much the bone has dropped, and actually give it a percentage versus saying mild, moderate, severe. We might be able to say there's 12% bone loss there, and 30% of the surfaces are covered in calculus, and then that is going to help us determine how to treat a little bit better. And so this is an application of AI that I'm seeing right now in several programs that dentists are using and helping patients to be able to see visually themselves and understand what's going on. And so at Express Dentist, we have a trusted network of dentists, and some of them are using AI applications already, even though it's early on. They're using some of these programs to help with care. If you need a dentist, reach out and let us know what you're looking for, what's important to you, and we'll help you get connected with someone in your area.